They do a laser scan of your chest wall, and you just basically stand there with your arms up. You don't feel a thing. It took maybe 10 minutes from beginning to end, and your image is right there on the computer screen, and they've got every little detail or measurement or whatever they need to make your new, your form. And that was it.
So what we wanted to do was reduce the weight, still maintain the feel and the texture and the consistency of the breast, of the human breast. So what was developed was a very lightweight foam. And this foam was literally developed by ContourMed with the help of other companies. But we described specifically what it was that we wanted, and we wanted something with volume that was tactile, that was soft, moved well with body movement. And what was developed then was the lightweight foam that is encapsulated literally in the breast form shape that is very soft and pliable, and we can match the color then also of the person's skin. So with that in mind, we had accomplished the lightweight, the tactile feeling, and the appropriate anatomy developed from the scanning technique. In addition to that, we wanted to be sure that they were as cool as they could be. So the back of the prosthesis is designed so that it wicks away moisture and literally microscopically lifts the surface away from the skin of the individual. So it's very lightweight, anatomically correct, which is electronically developed from the scanning technique, and then the milling machine that literally duplicates the shape of the reversal of the breast that's intact if it is a unilateral mastectomy. Each one is individually handmade, literally. Very custom from the scanning of the individual, because all of these ladies, all of their anatomy is very, very different. Depending upon their healing, depending upon how invasive the surgical procedure was, and what the resulting anatomy was when it was completed. This is truly a quantum leap in technology. This is very heavy, very hot, is a gel-filled sac, similar to a baggie filled with silicone. This is a very lightweight, anatomically correct breast prosthesis with a very cool, wicking back or posterior portion of the prosthesis, and women really enjoy that.
I was a little skeptical because I had seen custom forms before and I was not impressed with what I'd seen before. So I thought, okay, well, let's look into this. And I waited a while before I actually looked at it, seriously looked at it. And when I did, it was amazing the response I had from my ladies. I call them the ladies that I fit and have taken care of for years. And I always look and search for the very best things that are available to put us back together. And I thought, I think this is it. And sure enough, it is, because I had such a tremendous response. My first event, we scanned 19 breasts, the first event. And these women were so excited, like, wow, I'm going to be able to do the things I did before. I'm put back together. I am so me. This is me again. And it's just the way we all feel, myself included, because it fills in where everything that's missing. But the lightness of it was the big, big factor with every woman, the light weight, because there is no pressure on the shoulders. And it really makes a difference in the whole feel. Skin tone is a big factor, because like darker skinned ladies, they like knowing that there's something available to match their skin, because for so long they've had to wear forms that are the color of my skin or a shade thereof. So now they can wear whatever matches their skin.
One of the other advantages of the ContourMed prosthesis is the weight issue. Some people who have lymphedema or heaviness in their arm or have a lot of osteoporosis, they feel that with time that heavy off-the-shelf prosthesis is so uncomfortable or can increase or exacerbate some of these problems that they just don't wear it. Where the ContourMed prosthesis is lighter, it can alleviate some of those problems and definitely not allow them to propagate. And then they wear it more frequently, which brings them back to the symmetry issue. It's very important for a lot of reasons. The cancer diagnosis itself is very scary, and then the loss of a breast can add an additional burden to them. If we can bring them back to symmetry from that standpoint and focus more on the cancer and getting through the other treatments, it's much more beneficial to that patient, and they bounce back and recover quicker.
Okay, and then it goes from here and you do all of that, get that smooth, and then it goes over here. And we climb into the... We learn constantly from the patients. We create what they indicate they need or want or desire and what's comfortable for them. And it's not just a cosmetic approach. It's an anatomical approach and a functional approach. We really like to address the function because many of these ladies who have been devastated with a mastectomy, they get back into society and they're non-disfigured, but they're very active. They want to get back to doing the things that they did before they had the mastectomy.
Absolutely remarkable. I cannot think of another word just besides awesome, remarkable. For him to be able to provide that for me and other women that are in my situation, it's remarkable. I actually feel blessed.